Hello, I'm Patrick James Lynch, the co-founder and CEO of Believe Limited, and I live with severe hemophilia A and a tolerized inhibitor. But for my blood brothers and sisters in middle and low-income countries, access to a predictable and sustainable treatment is far more challenging. According to data, about half of all people worldwide with severe hemophilia die by age 10, and that doesn't account for the quality of life and opportunities, or lack thereof, for professional and social growth for those who survive past adolescence. Don't let anyone tell you that hemophilia isn't a serious condition anymore. It just depends on where you look. That said, progress has been made. Since 2015, I've had the honor of producing short documentaries for the World Federation of Hemophilia that feature the stories and experiences of patients, caregivers, and clinicians in places such as El Salvador, India, Vietnam, Kenya, and beyond. Stories that demonstrate the impact that progress has had on the community members living in these regions thanks to the work of the WFH Humanitarian Aid Program. These are beautiful short films, and I highly recommend you watch them. But what I don't often get to share, and what I'm proud to be able to share with you here today, are the personal insights and interactions that I've experienced along the way. The conversations that didn't make it into the final edit. Today I want to share with you some of the meaningful moments that I have witnessed and experienced on this journey over the past 7 years, from behind the lens. Take, for example, Mathieu, a pig farmer that I spoke with at a group meeting in Thiès, the third largest city in the country of Senegal.
Des médecins qui ne savent même pas ce que c'est que l'hémophilie.
Mathieu speaks French. I, unfortunately, do not. Luckily, we were able to connect through body language, tone of voice, and a skilled translator. He held a child in his arms as we spoke, a boy that had been diagnosed with hemophilia at 7 months old. I asked if there was anyone else in his family with a bleeding disorder.
Oui, son grand frère est décédé. Nous, on ne le savait pas, bien que je sois intellectuel. Donc nous, on avait, vous savez, c'est la culture africaine. Hein?
Il est décédé à quel âge?
Il est décédé à l'âge de 5 ans. Mais je crois que moi-même, j'avais une part de responsabilité de ne pas avoir trop creusé.
Unfortunately, stories like Mathieu's of feeling isolated, lacking support, treatment, and facing mortality are not uncommon.
When we went to hospital, we were advised by the doctor to our surprise, the boy was bleeding in the brain.
Se golpeó y pensamos que no era nada, pero lamentablemente no sabíamos que por dentro se estaba desangrando y no presentaba síntomas. 8 horas después empezó a convulsionar, los ojos se le iban, vomitaba y salimos corriendo al hospital.
Pak, saya mencoba pulang pergi gendong dia, sampai adiknya jalan kaki. Sampai orang kadang-kadang nanya, kenapa yang gede kok digendong? Yang kecil jalan. Saya mikirnya kalau dia jalan jauh, kakinya langsung bengkak.
That is when the journey started. A very, very tough journey, traumatizing journey.
So how do we find that glimmer of hope? Where does that spark start? What are the first steps?
Moi, je crois que les parents, la population doit s'impliquer. Les parents, direct et indirect, n'ont qu'à se mobiliser, n'est-ce pas, pour prendre en charge cette maladie. Parce qu'aujourd'hui, quand le papa, la maman, les oncles, tout le monde est impliqué, là, ce sera plus efficace.
There's no doubt that efficiency saves lives. And because bleeding disorders are rare and inherently personal, the first natural step is most certainly the support of family. Once mom and dad know, they can share with their parents and siblings and cousins and so on to figure out a familial structure to support the child in their younger years. But the support can't stop there. Mathieu's son has severe factor VIII deficiency, and needs access to medicine in order to survive into adulthood. Standing in a hotel garden overlooking the Atlantic Ocean in the most western point of Africa, I met a Nigerian woman named Megan who had taken things one step further than family. Megan's first son, born with a bleeding disorder in a country with no factor, went through his first blood transfusion at just 15 days old and would receive 6 more before he was 8 years old, all simply to keep him alive.
In 2004, I went online and searched Hemophilia foundations, and I saw 67 organizations. I went back home and I wrote my story and sent it to all 67. And
67 all around the world.
All around the world.
Megan soon had a donation of medicine, and suddenly the idea of keeping her child alive was a reality. When Megan saw that her story was traveling around the world, when she saw what a simple letter of advocacy could do, she started her own organization in Nigeria to help families like hers build the support they so desperately needed.
When I started, there was no patient support group. Today, families have a network of someone you can call who can share your experience. When I started, we were paying as much as $300 to $400 to get diagnosed. Today, because of the work we are doing together with the WFH, diagnosis is free.
Community support is a crucial safety net around a person living with a bleeding disorder, but it can't stop there.
The institution told me that they are going to give this boy the factor. And they promised me one thing: this drug is very, very expensive. So I told them, go ahead. Where will you get the money from? I told them, I don't know. What I don't want, don't let my son die. When we went back, God worked in a very miraculous way, because there was a nurse who was in turn and asked me, Mama Steve, you are taking factor. I'm going to connect you with a certain doctor in Kenyatta National Hospital. His name is Dr. Kibet. I asked, how much is they going to sell for us? Nothing. What do you mean? Where are they getting? Is it fake? Because I couldn't believe it was free.
When I was doing my postgraduate and undergraduate, I noted that there was one area of group of patients that had been left out. If you are diagnosed with hemophilia, it was as good as being sentenced to death. And in my training, I knew that no hemophiliac should go beyond 19 years. And that disturbed me.
As we were wrapping up with Kibet, he asked me a question that I have never forgotten. I didn't realize he didn't know that I had hemophilia and only knew me as the interviewer for the film we were making. When I told him that in fact I had severe hemophilia, he took a step back, scanned my body, and asked, "Can I take a picture of you?" He didn't ask to take a picture with me. He wanted a picture of me so that he could show his young patients what the possibility of life with hemophilia at 30 could look like. For him, I represented normalcy, something he wanted to show his patients was possible.
I don't know whether it will be too much to ask if we can possibly be planning ahead so that as we keep increasing the number of patients into our flock, we also increase the amount of donation so that then we don't flop backwards.
After knowing that he was suffering from hemophilia, our business had to stop so that we can concentrate on taking care of him and taking him to the hospital. We were told that this condition is not treatable, it is just controllable. But that made us to be scared because we knew what cannot be treated. Eventually it might cause death.
Fear often comes in many forms, and often we see it's not just fear of losing a child that's present, but fear of a familial burden, of being a burden on society.
My name is David Ole Sankok, a member of National Assembly representing persons with disability in the Parliament of Kenya. I'm also a Maasai from a pastoralist community, nomadic community, which before used to kill persons with disability because they were considered as a liability. But these things have changed because of the advocacy that we have made sure that we have taken, and for us being the role model that there is ability beyond disability.
Access to care at all stages of life, but especially early on, ensures that a person living with a bleeding disorder can not only survive but thrive as a contributor to their family and community, to become the next advocate, doctor, or minister of health, and to keep the cycle of support going. As you can see in these videos, things are improving by thinking outside the box, through partnerships between the many stakeholders, patients and their families, patient advocacy groups, government officials, healthcare providers, and industry partners. There is a new collaboration for hope. As we bring this to a close, let's go back to where we started, in Thiès, Senegal, with Mathieu.
Si vous vous intéressez à la moustique, c'est parce qu'elle vous a piqué.
Oui.
Mais tant qu'elle ne vous pique pas, vous ne vous intéressez pas.
If you're still watching this, there is no doubt that you've been bit. And the question isn't whether or not you should care. You should. The question is, what does care look like? And I dare you to dream big, because my blood brothers and sisters and I, we're worth it.